Question was, is there a time when someone's really stuck with their trauma in terms of not making progress, where it would be appropriate to push someone or sort of nudge them forward so that they deal with their issues? So I thought that was a pretty good question. So the very short answer to that question is no. And that's mainly because even though it might seem true to you that would be useful to them, there's no way for you to know that you're right. So what you have to look at it as is like, if you're wrong, what's going to happen? And you're basically going to trigger them and maybe set them back. You also move into like an ethical line of doing something that is not what someone asked you. So that's the short, we'll call that the official short version. There's a longer version though, that comes up if you start doing a lot of work where you get to know people really well and they're requesting techniques and advice on how to move forward. And as a yoga therapist, you're sort of in the capacity of trying to help them evolve in the way that they've requested. And so you can't always be coddling, for sure. But even with that, it's kind of a fine line. So the sort of second answer, which is the opposite answer, if you see that somebody's requested this kind of work with you and you see that you have to move forward, it still has to be phrased as a question set with consent sort of built in. So it would sound something like, and I always say it like this way. I mean, you could have your own way, but I purposely say I could be wrong because that's true. You know, I could be wrong, but it seems to me that you've been pushing up against this for a long time and you've asked me to help you. And I'm, you know, in considering this, I've thought about this kind of practice, which would push you directly up against your stuff. And, you know, there's a sort of chance that would be very useful to you. Of course, I'm not positive of that, but I wanted to know what you think of that. So it would have to sound something like that. And it would definitely have to be a group activity, sort of figuring out what to do and sort of getting the client to sign on to that. So as I say, a lot of times you want to be careful not to be in the wrong role of a therapist or a life coach, etc. So, you know, that's tricky. If you're playing dual roles, like you are a life coach, which happens a lot, this kind of work, people have multiple skill sets. You still have to stay within your purview. So like I should have said, if you are a therapist, say, you still have to sort of work with that theoretical construct and not mix the two too closely together, like allow the person to breathe in the like psychological unpacking of something space before you give them practices, right? That could be dangerous, getting them into their difficult places before they've unpacked it properly. So that's my answer. So don't push, don't coddle, and if you need to present something, it needs to be done in a way where you're presenting it as an idea to be sort of put into the room. And then, you know, either the client attaches to that as a great idea or not, you know, and you'll see quickly. I guess I should also say with all that you can always backtrack. So with trauma, it's a little difficult. You know, you definitely don't want to overstep, but sometimes we overstep in all sorts of ways in this work. If you overstep, you can always backtrack. The key to backtracking, right, is to say, I think that maybe wasn't the best idea. I thought it was, but now I realize that this might be better for you. Often clients don't like that. They say, no, I want it. They feel like they need to succeed. They don't want to disappoint you, often is a common dynamic. So, they're like, no, I want to do this thing. I really can do it. And you have to sort of say, I know you can do it. But your reaction shows me that it's not the most efficient and best way to get you to meet your goals. So I want to take a different track. So you sort of present it as different, not less than.